Kia ora. I'd just like to read you something and tell me what you think. It's a quote. "We don't smoke this shit, we just sell it. We reserve the right to smoke for the young, the poor, the black and the stupid." That's a quote attributed to a tobacco company executive. Was that a quote from one of your company executives?
No, it was not a quote from one of our company executives.
Is that a philosophy that your company follows?
No, it is not. It is a stupid comment.
Do either of you smoke?
I am a former smoker.
Do either of you smoke?
I've never smoked.
So you don't smoke?
Not now.
You say that government should be looking after the nation's health, but that there is a need to maintain individual adult choice?
I believe so.
Do you know that the average age for smoking uptake is 14 and a half?
I'm aware that smoking incidence and starting of smoking starts below the age of 18, yes.
Do you agree that the nation's health comes before individual choice?
I believe that governments have a responsibility to legislate and that adults should have access to tobacco products if they choose to.
Do you accept that there is no choice in addiction?
I acknowledge tobacco is addictive.
Do you accept that nicotine is an addictive substance? Do you?
I do.
So supplementary to that, do you know the makeup of what's in a cigarette?
Tobacco is a very complex product.
Shouldn't it be just the stuff that you grow out of the ground?
It is the stuff that comes from a
So
paddock.
what else is in the cigarette that I smoke?
Well, in tailor-made cigarettes, there are very few ingredients added. Mentholation is added to menthol products. Within RYO, there are some other ingredients added, but they do not add to addiction and they do not increase nicotine. For the last 19 years, our company has provided the New Zealand Ministry of Health with a list of ingredients that we add to tobacco products. There is nothing that's added to the tobacco products that makes it any more addictive or adds to the nicotine content.
Do you know whether sugar is added?
Sugar is added in some RYO, some roll-your-own products, yes.
All of the medical personnel who have presented to this committee and all of the medical research we have read tells us that there are no benefits to smoking tobacco. And in your own 38-page submission, you don't mention any either. Do you accept that there are no medical benefits to smoking tobacco?
I'm unaware of any medical benefits to smoking tobacco.
Health researchers also tell us that 1 out of every 2 long-term smokers will die from smoking. Many health boards and agencies have identified stopping smoking as one of their top priorities. And indeed, your own submission says that smokers are well aware of the serious health risks associated with smoking. Are you also well aware that there are serious health risks associated with smoking?
Yes, we are aware of the serious health risks.
Can you tell us why you still sell a product that you know poses serious health risks?
Tobacco is a legal product. Tobacco is a legal product and we operate a commercial business.
As a primary producer of cigarettes, do you accept any responsibility for the serious health risks, illness and premature deaths your product causes?
We sell products and we offer products for sale to adults who are aware of the risks and make a personal choice to choose that product.
Just supplementary to that, my question was, do you accept any responsibility for the serious health risks that you acknowledge, illness and premature deaths that your product causes?
We sell a product that is legal, we sell a product that's legal.
I don't think anyone sitting on the select committee would say otherwise than tobacco is a wholly negative influence in our country. I want to pick up on what you've said about the illicit trade in it. Effectively, whilst you might not put it this way, is what you're saying to us that whilst you're a devil, it's better the devil you know than the devil you don't know. And can I put it to you a bit like this? is it your position, for example, that if we put taxes up substantially on tobacco, we'll see the illicit trade grow substantially? If we were to ban it, we'd again see that occur, and we'd perhaps see much bigger problems, or at least a different set of problems than we see from tobacco as it is today.
Sure. If I can take the last part of the question first, if you're asking will prohibition work, in my view and my company's view, no it won't, because an illicit trade will flourish in our view in this country. As we said in the submission, when you have an illicit trade, there is no health warning on an illicit products. There is no product control. There's no tax collected. So the short answer is yes, we believe there will be a significant growth in illicit trade.
Just picking up on illegal trade, etc. A report titled Key to the Future, British American Tobacco and Cigarette Smuggling in China states categorically that BAT's own documents demonstrate that contraband has been a hugely profitable and integral part of BAT operations in China over the past 2 decades. The report adds that the value of the illicit trade amounts to billions of US dollars. It goes on to say that for the Chinese government, this illicit trade undermined restrictions on imports, represented an enormous loss of tax revenue, and stimulated demand for premium brand cigarettes. Given the level of illegality and deception that BAT is willing to engage in overseas, is there any reason to think you would not do so here?
I'm unaware of the report you refer to. Our policy around illicit trade is quite clear, and cross-border transition, and we will not engage in any of that process.
So, let's say we've heard as a submission to us, tobacco is banned tomorrow. You presumably would move out of the market. Have you any evidence or research as to who would move in?
We believe that there is a black market already established. We can provide detail of that black market outside of this session. It would grow in our view.
It would become more of a problem.
I believe so.
Material.
Kia ora. Thank you for your submission. Just on, I guess I'll supplement you first on the issue around illicit trade. We've heard evidence this morning that the kind of people who grow their own tobacco, for example, that kind of model, doesn't have the same health consequences that the commercial sale of tobacco does, and particularly because of the additives that are added to cigarettes. Do you have any view over that?
Well, the first point's incorrect. If you grow tobacco is a naturally occurring product. When we process our tobacco in our factory in Sydney, our TMC is basically processed with steam and water. Our RYO has some ingredients such as sugar added to it, but it's fundamentally, that is fundamentally the basic process. It does not add to the process. The inference that homegrown tobacco is any better for you is incorrect.
Not as problematic. Doesn't cause as much health damage. I think it's the argument of it's better for you. It doesn't cause.
Well, I don't believe it's any different to.
Is there whatever? I mean, you must have done research on the consequences of the burning of material or additives that have been included in commercial cigarettes. You have evidence or any reports or information about the damage that the burnt material causes from the additives that you've added?
Which material? This is the tobacco?
In terms of the chemicals or the treatment of tobacco, of the raw product.